Welcome to another episode of Doctor's Eyes Only podcast. I'm Brad Quick, one of the partners and president of Vestia Personal Wealth Advisors. And today we're going to be talking about Vestia Consulting. We'll tell you what it is and how it might impact you. Some of the things I learned in my orthopedic career, there was kind of these breadcrumbs that all came together and culminated in kind of the genesis, the start of the Vestia Consulting business. I worked with a lot of surgeons who all had great ideas. They worked with their hands every day. They had ideas of, boy, this part is not optimal. How can I fix this? And so they had ideas, in some cases, patents. And then the other thing that really struck me, there was one of the last businesses that I ran. I was a general manager of the foot and ankle business at Zimmer Biomet. And it was really difficult to get products to market. And so I was looking around at how do I get something out. I had the task of building an entire portfolio for foot and ankle. It was a relatively new business for us, and we were tasked to grow this thing significantly. The other thing I knew is it took, on average, it's like 4 years to bring a product to market. And so that just wasn't good enough. We had to move faster. And so I struck a deal with a local innovative shop, the name of Nextremity Solutions, who was amazing. They were innovative, they were fast, and we created an entire portfolio in about 3 years. And so there are numerous products. There were 8, 9 products that really helped build out our portfolio. And so I thought, boy, there's something different here rather than just innovating in-house. How do we leverage some of these very smart people outside who can move very quickly, way more fast than we could, and help others do what we did at Zimmer Biomet in that case. Sure, a lot of people think, boy, I'm relinquishing control, and how much am I going to get what I want, or am I going to get fired for this, right? But what I was faced with is just the sheer reality that I knew it was either have nothing to sell, because again, and it's nothing against large companies. They're all expert at what they do, but with their processes, with their multiple layers of approval, and the fact that the FDA just looks at them differently, there's way faster ways to get things done. And that was kind of the only solution I had. And it's something now that many people are doing. There's a lot of these shops. The biggest impact really here was to the patient, because for us, we had some real portfolio gaps. There was things that we may not have had the optimal solution for. And I guess then in this case, it was likely somebody else's implants were going in. But for us, coming up with a brand new plating system, that's the entry for foot and ankle. That's what most of the business is kind of a platform of plating. And so we were able to develop that and launch that, and it kind of innovative. Again, there were some cool things that were didn't require sterilization. They came pre-packed sterilized, versus some now have to get sterilized every time before they're used in the hospital. So there were some things actually that were really cool and innovative, again, that came from this, using somebody that was outside and expert at doing it fast. The fact that I saw how good that felt to somebody leading a group, leading a product management group and general manager. And then fast forward, I'm now at Vestia and have the opportunity. I'm actually still helping some friends I had from my prior life, actually in this case, foot and ankle surgeon friends. They were going through negotiations with some of the majors. Because I had sat on the other side of the table, because I had sat on that seat, I was able to give them really good advice, help them understand, here's the things I would have been looking at. Here's how we would value that. Here's some of the levers you can pull. Oh, I can't pay you any more guarantee, but I can add royalties, for example. So just knowing the way a large company looks at that, and kind of some of the valuations they use and ways to think about it, I was able to help them negotiate that successfully. Actually, they've had a couple of cool exits, and there's a handful more that they're in the process of working on, and where I'm also giving them advice on how to get those into the market. Now I've got the start. Now I've got the platform to be able to help more broadly. And this just became an extension as I've continued to talk to a lot of those folks, as I continue to talk to in this case, some of the foot and ankle folks who are innovators, literally started their own foot and ankle development company, and brought things from idea through patents, through development, FDA clearance, and sale. Actually, another one in there is clinical use, proven clinical use, and then sale. it just was a natural extension to think about, boy, we can do this for others, because there are a lot, as I said earlier, there's a lot of innovators that are orthopedic surgeons, because every day they see how to use something and they think about different, better ways to do what they're doing. In general, most folks, the reason they're seeking help is because they're stuck, right? Whether it's stuck for, I've got an idea, or I've got a patent, or I've launched and it's just not, we're not seeing the revenue that we need. I had one of those with the rehabilitation device, where kind of stuck, and now what's next? I want to grow. How do I get this thing to a point where we can really grow and exit? And so it's just understanding, what does it need? Do we need a clinical study? Do we need to show revenue? What are the things that the majors are looking for to be able to really be interested in taking that and adding that to their portfolio? How do you de-risk it? How do you make it to a point where it's a no-brainer to add to their portfolio? What I've found, the people that reach out to me are stuck in one of a couple ways. One is just even getting started. One of the folks that reached out literally said, I have these ideas, I have patents, and I just don't know how to approach these major corporations. And so being in the business, and it is a very incestuous, multi-billion-dollar industry of orthopedics, but once you know several people in the business, a lot of folks have moved around, and so you do then all of a sudden have contacts at many of the companies. So people get stuck and just don't know where to start, and so that's a really good place. I'd certainly give a free look and see, yes, this is something that I do think is got legs, and here's what it would look like to work with us. The other one is it kind of stalled. And so some of the businesses that get to a point where I've capped out at $1 million, or I've got FDA clearance and I'm negotiating, and I don't know what the guidelines are. I don't know what the range of value is. And so because I've sat through a lot of these acquisitions, I was part of the Zimmer acquisition of Biomet. It was a multi-billion-dollar acquisition. I was leading the knee team at the time, which was the largest part of the acquisition, the largest franchise. And so I've seen what these look like and what people are looking for. And so just that knowledge, that ability to understand how to get unstuck, how to keep things moving, how to grow, that's been a consistency. So any of those where you're stuck, I don't know where to start, I'm stuck, I've capped out, I've reached the ceiling, or I'm just not sure what the value of this thing, how to value it, how to begin the negotiations. I don't have the contacts. Really, any of those things is where I've been able to help folks get them pointed in the right directions. And some of those are, look, we're not going to work together, but here's some ideas of what I would do. And then if it gets to a point where it makes sense for me to step back in, I'm happy to do that. There's been two of these that really struck home that this is an area where we can add a ton of value. And so the first one was meeting with an extremity surgeon who had some really cool innovations, including patents, on how to do something kind of in his niche, in his space. And what I was able to see is, boy, this innovation is great, but there's even bigger application, and there's way more growth opportunity and, frankly, occurrence rate of this issue in a different part of the body. And so I was able to add that value, show him the market, the growth, and he is all about it now. And we've really crafted the story, taken this IP, talking about next steps, already presented it to one of the majors, have another one of them scheduled to talk about it. And so that was one that it was really opened his eyes. So really part of that was he had 4 or 5 things which he had ideas about, but it was sorting through as the ability to see the market, to understand the market, to understand what gaps exist and how this could really help fulfill the need for some of the, a couple of the major players. And that just knowing that, being able to put together, kind of talking back to those breadcrumbs, some of the knowledge I had acquired and size of markets and growth rates and things like that, as well as competitive offerings that really helped point this to the best opportunity. And we're seeing that there's some really strong receptivity from this technology there. The other one, frankly, is back to when I was in at Zimmer Biomet, the extremities businesses. Kind of one of the uniques was a lot of great, you can have great products there, but Stryker was the one who kind of figured it out in the foot and ankle business. They went from being in kind of a middle of the road player to being number 1 or 2 in the space. And the main difference there, the products were good. They acquired a couple, they built out the portfolio, but the biggest driver was filling out their sales channel, having a dedicated sales force. And so bringing that to, there was another orthopedic company in one of the niche areas of the body, not a hip or knee, which is the majority of what people sell. and they were kind of capped out as far as their ability to grow. And it was really bringing that knowledge and saying, the way you're going to get to that next level and really increase your value is to fix the sales piece, to bring on coverage reps, to do other things that are going to enable you to really run in an open field and grow significantly. And so that was just another area where having that knowledge, seeing that firsthand, it being looking around and seeing what successes happen in the marketplace, was able to bring that knowledge and know how to be able to grow kind of when they were stuck. Thank you for tuning in to this episode of Doctor's Eyes Only podcast. My name is Brad Quick. Please like and subscribe. And if you have any desire to reach out and hear more, feel free to reach out to me directly at bequick@vestia.com. That's bequick@vestia.com. Thanks and have a great day.
The information covered and posted represents the views and opinions of the guest and does not necessarily represent the views or opinions of Vestia Advisors, LLC. The content has been made available for informational and educational purposes only. It should not be construed as legal or tax advice and is not intended to replace the advice of a qualified attorney or tax advisor. This information is not an offer or a solicitation to buy or sell securities. Investing involves risk, including risk of loss. Before investing, you should consider the investment objectives, risks, charges, and expenses associated with investment products. Investment decisions should be based on an individual's own goals, time horizon, and tolerance for risk. Past performance is no guarantee of future results. Diversification and asset allocation do not ensure a profit or guarantee against loss. Consult your financial professional before making any investments. Investment advisory services offered through Vestia Personal Wealth Advisors, Vestia Retirement Plan Consultants, and Vestia Advisors, LLC. Securities offered through Osdale Financial Partners, Inc., 5187 Utica Ridge Road, Davenport, Iowa, 52807. Member, FINRA, SIPC. Vestia Personal Wealth Advisors, Vestia Retirement Plan Consultants, Vestia Advisors, LLC, and Osdale Financial Partners, Inc. are independently owned and operated.